transnasal lacrimal stent is designed for use with balloon catheter DCRs, endoscopic DCRs, and external DCRs. The transnasal lacrimal stent has a significantly larger diameter than other stents, which is made possible by inserting it transnasally. The larger stent size results in a very high success rate for lacrimal procedures. There is a sheath and a long probe. During insertion, the long probe is placed inside the sheath to aid in positioning. The smaller diameter end of the stent contains a short probe. This is a close-up of the very large diameter end of the stent, which is shown on the lower portion of the photograph. And on the upper portion of the photograph is a smaller diameter end of the stent with an completely enclosed short probe. The sheath with the enclosed long probe is inserted through the superior punctum and canaliculus and pushed through the DCR or balloon DCR ostium into the nose. Here the sheath can be seen exiting the balloon DCR ostium on the right side of the screen. The nasal septum is on the left side of the screen. The probe is then pulled back out the sheath and removed. The sheath is then grasped with a straight mosquito hemostat intranasally and pulled down the nose and out the nares. The mosquito hemostat crimps the end of the sheath, and the very distal end is therefore cut off. The small diameter of the stent with the enclosed short probe is then inserted into the sheath. The sheath is then pulled back out the superior canaliculus, thereby pulling the probe and small diameter of the stent out the superior canaliculus. This pulls the very large diameter end of the stent up the nose and into the balloon DCR ostium and lacrimal sac. The small diameter end of the stent with the enclosed short probe is now inserted into the inferior canaliculus, lacrimal sac, and DCR ostium into the nose. The small diameter end of the stent with the probe can be seen exiting the DCR ostium on the right of the screen. This is then grasped with a straight mosquito hemostat and pulled down the nose and out the nares. Here both ends of the stent can be seen exiting the balloon DCR ostium on the right of the screen. The nasal septum again is on the left. The smaller diameter end of the stent is left much longer than the large diameter end and is cut off just inside the nares. Postoperatively, at least once a month, the stent should be repositioned. This is done by grasping the longer end of the stent and pulling on it, which will in turn pull the short, large diameter end of the stent back into the lacrimal sac and DCR ostium. The large diameter end of the stent tends to migrate into the nose and should be pulled back into position at least once a month after surgery. It is also important when the stent is removed 4 to 5 months after surgery that no infection is present. Infection with this stent is manifest as either increased tearing or a low-grade discharge. Frank dacrocystitis does not develop. However, when low-grade discharge or increased tearing are present, treatment with 2 weeks of Cipro 500 milligrams twice a day is required. This will diminish inflammation of the surrounding tissues and prevent stenosis of the ostium after stent removal.